The target: Christ-focused adolescents who are working through and grieving childhood trauma. Children are born as spiritual beings, and they're created for relationship with God. However, their spiritual development is shaped by many factors, including their experience of trauma. Sadly, since ancient times, many children have experienced significant trauma, and the Bible deals with this topic openly and honestly. Trauma may impact a child's overall development, and especially their spiritual development. While many of these impacts may be negative, the Bible also offers significant hope for children growing up in the midst of trauma. Although there is a considerable amount of evidence that religion and spirituality are protective factors in buffering against the negative experiences of trauma, there's also significant evidence that trauma is a risk factor for the development of post-traumatic stress related to faith. There are three types of religious or spiritual struggles that have been identified: interpersonal, intrapersonal, and divine, with attachment to God focusing on the divine. Individuals who perceive God as all-loving and all-powerful and then are subsequently exposed to trauma may experience cognitive dissonance. In order to resolve the dissonance regarding their perception of God and suffering, some individuals may develop an emotional distrust of God's love and His power, which is consistent with an anxious attachment to God. In contrast, others may develop an intellectual distance from God, consistent with an avoidant God attachment style. Regardless, following exposure to traumatic events during childhood, religious individuals may adopt a style that either compensates for or corresponds to the human attachments that they have formed. Childhood trauma is common and it is profound. Even during times of peace, childhood trauma is more common than is generally recognized. In one U.S. study with over 16,000 participants, about 50% experienced at least one childhood trauma, and a quarter of respondents had experienced multiple traumas. And in times of national trauma, like in the Ukraine, childhood trauma is multiplied and it's intensified. Childhood trauma significantly impacts a child's development with long-term consequences. In short, children who experience significant trauma are more likely to develop life-threatening emotional and physical health conditions. They're also more likely to struggle at school and exhibit self-destructive behaviors. The disciplines of spiritual and pastoral psychology are uniquely poised to reconceptualize trauma and reframe it as part of a stress-trauma continuum, given the way that trauma can engender great suffering as well as resistance and the possibility of transformation. Here we remember Joseph's words to his brothers: "You intended to harm me, but God intended it for good, to accomplish what is now being done, the saving of many lives." Cognitive processing therapy has a primary focus on reviewing past trauma, engaging its impact on a client's thinking, and to what extent they have processed the traumatic events in the moment as well as in their current place in life. I'd like to examine three key factors of CPT: stuck points, motivation, and comorbidity. CPT plays an integral role in the recognition of negative thoughts that are trauma created and keep people stuck points, in their PTSD and block the path to recovery. With stuck points, we must remember that the mind is a battlefield and we must always be on guard against attack. I think it no accident that Paul refers to the item that protects the head in Ephesians 6 as the helmet of salvation. We often see salvation as a matter of the heart, but clearly Paul also equates it with the head. Our thoughts must be captive to Christ, 2 Corinthians 10:5, and those who wish to walk a journey of recovery must reject trauma-created negative thoughts. The most important factor for a counselor to keep in mind to determine whether to proceed with CPT regards how motivated a client is to proceed with therapeutic intervention. Motivation is linked with persistence, with well-being and higher achievement, and is dependent on meeting three psychological needs: autonomy, relatedness, and competence. Relatedness alludes to possessing a sense of meaningful connection and belonging, as it is thought to be one of humanity's basic psychological needs. Autonomy focuses on one's individual ability to navigate personal decisions and be the primary protector of their own well-being. Competence spans all levels of education, professional domain, and diverse societal status, and it refers to an individual's ability to perform action in real-world context. All three components should be present to achieve optimal motivation. Comorbidity with depression for adolescents who have experienced trauma as a child is a very real problem. Depression disorders are comorbid with PTSD more than any other disorder, and treatment outcome studies have indicated that CPT has led to lasting and substantial changes in depression symptoms as well as symptomatic improvement with PTSD. People with major depressive disorder, MDD, and PTSD comorbidity tend to have a greater psychological burden than those with PTSD alone. And there's also typically the presence of more suicidal thought, more distress, poorer quality of life, as well as worse options for treatment and a higher dropout rate. The great takeaway for me here is that CPT offers a twofold benefit for the patient in the therapeutic process. The fact that depression and PTSD commonly occur together, and CPT offers benefits for both, strongly encourages me to pursue CPT as a therapeutic model. Cognitive processing therapy, or CPT, is a leading therapeutic treatment for PTSD. But spiritually integrated cognitive processing therapy, or SICPT, incorporates traditional CPT and components of faith. This means an incorporation of a traditional CPT therapeutic approach with faith or scriptural components, and it is proven to be effective not only to address PTSD, but also to offer adolescent and adult survivors of childhood trauma an attachment security to God. SICPT is the first one-on-one individualized psychotherapeutic treatment that integrates a person's spiritual and religious beliefs into treatment, using this treatment to work through and process the spiritual, psychological, and religious symptoms of PTSD. SICPT focuses on the integration of spiritual elements into evidence-based practices of CPT, and it provides additional support for survivors of trauma whose spiritual beliefs are key to their identity and therefore a key to their healing process. SICPT is particularly helpful in dealing with moral injuries. The concept of a moral injury was originally discussed in relationship to navigating the moral values and beliefs for military personnel during wartime, but it has expanded beyond this context to include similar emotions shared by those who experience moral emotions resulting from events witnessed or personally experienced in their personal or professional lives that are traumatic in nature. Moral injuries are closely linked with the ideas of guilt, shame, and a loss of trust in self or others, and they're now seen in adverse and abusive childhood experiences. SICPT can also offer additional benefit in the treatment of something that we've already identified, stuck points. Spiritual struggles are considered to be among the most severe of all conflict, and they can shake the client to the core and raise fundamental questions about value, practice, belief, and even a reason for living that lends direction and balance to life. It makes sense to me then that our spiritual views are our most fundamental, and so then logically they would be the most susceptible to stuck points. I also see that SICPT would be the best avenue to address these spiritual stuck points. Trauma-Informed Pastoral Counseling, or TIPC, offers the opportunity for the integration of spiritual and clinical approaches within churches and other faith-based communities, which is necessary for the promotion of holistic healing and lasting behavioral change. A key concept of TIPC is protective denial. Denial is often viewed negatively, but can also have positive benefits. Denial offers a line of defense when the truth is too difficult or painful to accept, and it allows individuals time to slowly process traumatic information in a digestible form. But trauma destroys protective denial. Denial instills a sense of safety that, when removed by trauma, may precipitate unnecessary changes or unhealthy views of self or others. The 4 R's. The 4 R's of trauma-informed pastoral care are realizing the impact of trauma, recognizing symptoms and signs, responding with supportive services, and resisting re-traumatization. Realizing the impact of trauma. After being exposed to a traumatic event, students may exhibit changes in behavior, including changes in their appetite, unexplained absences, angry outbursts, decreased attention, or withdrawal. There may be long-term impacts on learning that include disruptions to brain development that can be seen in challenges with attention, language, memory, cognitive flexibility, and emotional regulation. Self-esteem and the ability to develop and sustain positive relationships may also be affected by trauma. Each of these neurological effects is reversible, as the brain has tremendous neuroplasticity. With repeated and scaffolding practice, the brain can be rewired. Recognizing symptoms and signs. Adolescents may reenact their trauma through defensive or protective expressions of anger and aggression because they fear emotional vulnerability in experiencing additional traumas, and they may cope with alcohol, drugs, and self-inflicted injuries to numb their emotional pain and suffering. Responding with supportive services. Trauma-focused therapies result in improved outcomes for adolescents with traumatic stress when compared with both waitlist and active controls. Evidence-based, trauma-focused therapies have several components that are similar across all interventions. These components include psychoeducation on how adolescents may continue to be bothered by the traumatic event, including the core components of PTSD, even when they're safe. The use of coping skills or other techniques to empower the adolescent to decrease symptoms when distressed or traumatic memories are triggered. The opportunity for either gradual exposure and or cognitive processing to decrease the frequency and intensity of future trauma-associated reactions, and guidance around improved safety both during and after therapy. Resisting re-traumatization. In therapy, re-traumatization happens when a client is exposed to events or memories or therapeutic processes that make them vividly relive a past trauma. Trauma impacts all individuals, patients and providers alike, across the lifespan and across generations. Awareness of the breadth and depth of trauma and its impact on healthcare outcomes is critical to improving the health of all patients as well as those providing care. When these four concepts, the 4 R's, are administered through a Christ-centered focus with the gospel message at the center, spiritual healing and salvation may result. Acceptance and Commitment Theory, or ACT, complements SICPT and trauma-informed pastoral counseling by focusing on action driven by spiritual value and psychological flexibility, which allows clients to detach from thinking judgmentally rather than needing change. ACT promotes 6 fundamental processes that collectively enhance psychological flexibility. They're acceptance, cognitive diffusion, being present, self as context, values clarification, and committed action. These processes are interrelated and they work together to help individuals lead a more meaningful and fulfilling life. Acceptance. Acceptance involves embracing all thoughts and emotions, including those that are uncomfortable, as an inherent part of the human experience. This process encourages individuals to open up about their internal experiences rather than avoiding them or resisting them, and it fosters a more adaptive and compassionate stance toward oneself. Cognitive diffusion. Cognitive diffusion refers to creating a psychological distance from your thoughts, helping you to perceive thoughts as passing events rather than concrete truths. Cognitive diffusion techniques, such as metaphors or mindfulness, aid in reducing the impact of unhelpful thoughts on behavior, and they allow for greater flexibility in responding to various situations. Being present. Being present emphasizes maintaining a non-judgmental awareness of the present moment, which can reduce rumination and also alleviate anxiety. Mindfulness practices are central to this process, and they encourage individuals to focus on their current experiences and engage fully with those who are present. These mindfulness skills help clients contact the present moment rather than dwelling on the past or worrying about the future. Self as context. SAC is conveniently taught as an extension of mindfulness, and it enables individuals to focus on stable, grounded, and enduring senses of self, and they're able to have a flexible perspective. This approach involves understanding that one's identity is distinct from their thoughts and feelings, and it fosters a stable sense of self amidst changing internal experience. This perspective helps individuals maintain a consistent sense of self-identity even as their thoughts and their emotions fluctuate. Values clarification. This entails identifying what you feel is truly important and aligning your actions with these personal values. This process provides direction and it provides purpose, and it helps individuals prioritize meaningful activities and pursue goals that align with their core beliefs. Committed action. Committed action encourages taking concrete steps towards your goals that are consistent with your values, and it promotes perseverance and adaptability. Committed action involves setting specific, values-driven goals and then pursuing them despite whatever obstacles may arise, which enhances overall life satisfaction and achievement. These 6 core processes form the foundation of ACT, and they're essential for cultivating psychological flexibility. They provide a comprehensive framework for individuals who are seeking to navigate life's challenges more effectively, fostering a more fulfilling and adaptive life. A key component to help the target audience, an adolescent attempting to navigate the path of childhood trauma recovery, involves a mindful action plan. ACT allows for finding your why, what brings purpose and meaning to your life, and finding your way, the actions that bring you closer to fulfilling your purpose. And this may be best visualized through a mindful action plan. The mindful action plan involves the construction of a to-do list, which is based on your personal values, while exercising mindfulness skills and dealing with negative thought. The second fundamental process of ACT, cognitive diffusion, should be a primary point of focus here, with the implementation of a diffusion intervention. The term fusion refers to the process or the result of combining 2 or more things, which are distinct entities, to form one. And the way fusion is used in ACT refers to the joining of a client's view of their self with some part of that individual's internal experience. Cognitive diffusion interventions, such as metaphors or mindfulness, aid in the reduction of the impact of unhelpful behavioral thinking, which then allows for a greater flexibility in the response to various situations. As we look at a Christian worldview, I need to say I think it's difficult to not see things through a Christian worldview lens. As a follower of Christ, I sense that my daily calling is just to offer my best to Him. My motivation is found in my life verse, but seek first His kingdom and His righteousness, and all these things will be given to you as well. A sense of calling, which is a primary Christian motivation, can help Christ followers set purposeful and meaningful goals, overcome the challenges of life, and offer continued motivation to minister to others, as well as building self-efficacy. It seems to me that all 3 of these therapeutic models can be catered to an individual's needs. And I believe that Scripture is clear that we're each created uniquely, 1 Peter 2:9, and that Christ came and died for the salvation of all, 1 Timothy 1:15. The application here that I must remember is that because people matter to Christ, they must then matter to me, and I should do my best to meet their needs. CPT, and I suppose all of the therapeutic models, deal with revisiting the past. One of the great promises of Scripture to me is in Isaiah 43:25, which promises that God does not just forgive our sin, but He remembers it no more. It's important to revisit past trauma, but I also want to always remember and remind those I counsel that past sin can be forgiven, 1 John 1:9, and forgotten. Trauma-informed pastoral counseling is by definition pastoral counseling, so its integration with a Christian worldview is obvious. Pastors who focus on pastoral care are well positioned to offer meaningful intervention to victims of trauma through their mediation of the presence, knowledge, and experience of God, and through intentional space that they occupy within congregations and communities. ACT is the therapeutic model that researchers on Christian counseling are most interested in, and its core elements, according to ACT's founder, attest that it is inherently spiritual and is dependent on the client's unique spiritual perspective. I just don't foresee using any therapeutic intervention in my ministry that would not incorporate an integration of a Christian worldview. One of my favorite quotes is by C.S. Lewis, who said, "I believe in Christianity as I believe that the sun has risen, not only because I see it, but because by it I see everything else." In my thinking, Lewis's quote indicates that Christ is not a part of what we do, he is all of what we do. That must mean that in the therapeutic process, Christ must not be integrated, but rather we integrate counseling into a Christian worldview. Luke 2:52 offers the only perspective of the life of Christ from the ages of 12 to 30. It says he grew in wisdom and in stature and in favor with God and man. So Jesus grew mentally, physically, spiritually, and socially into a whole person. And that's my prayer for each of the students I work with, that they might grow in those 4 areas and that they might grow centered in Christ. Well, childhood trauma can affect that trajectory. But I believe with intervention, the bullseye can still be reached. Remember again Joseph's words to his brothers, "You intended to harm me, but God has intended it for good, to accomplish what is now being done, the saving of many lives." God will truly use the tragedy of childhood trauma and do a mighty work in the lives of adolescents who are ready to be used by Him. With SICPT and with trauma-informed pastoral counseling, with ACT components, the bullseye, it may and it must be reached.